For the parents of children suffering from rare immune diseases, there are often no conclusive answers as to why their loved ones are so sick. The fear of this unknown is an enormous additional layer of trauma for the parents of these kids. That's why we developed a multidisciplinary team called the Clinical Immunogenomics Research Consortium of Australia, or CIRCA. Together, we're tackling the most mysterious and devastating immune diseases, many of which affect children. The CIRCA program is patient-focused and a true collaboration. Researchers here at the Garvan contribute to CIRCA by working with doctors who are seeing the patients and by delivering whole genome sequencing so that together we can quickly work out what the genetic cause of these conditions is, and then, when possible, move these patients onto therapy, hopefully within a few months. For some, it's resulted in a genetic diagnosis, which is really important, but for some others, it's resulted in much better clinical outcomes, and in some cases, it's actually saved lives. One great example of this is a little girl called Stella. At just a few weeks of age, Stella had a life-threatening immune disorder that really no one was clear what was going wrong. For over a year, her parents struggled along with the clinicians to really get a proper diagnosis, and this led to them living with the fear of the unknown and really what was in store for Stella's future. Through the whole genome sequencing part of CIRCA, we discovered that Stella was one of only a few hundred people in the world who had had a mutation or an error in a gene called DOCA. And this, as a disease, was really only reported 10 years ago. Because of this, we knew what the best practice of treatment was for Stella. We could implement that, and she received life-saving treatment and is now a very healthy young little girl. What we're especially proud of is that people who have been part of our program, like Stella, is that their time that they have to spend in hospital before they've been diagnosed has been dramatically reduced. So before genetic diagnosis, they would spend up to 10 weeks in hospital, but now it's less than 1 week. So because of you, we've made a real difference for children like Stella. But there's still so much more work that needs to be done, and there are so many more kids like Stella and many affected families and parents that suffer at the hands of these unknown diseases. With your help, we're able to discover the unknown, find better treatments, and in some cases, like we did for Stella, save lives.